In the ancient world, where the art and science of dentistry were still in their infancy, the people of Persia had developed fascinating, albeit crude, methods for dealing with dental problems. Set against the backdrop of a sophisticated civilization that spanned much of modern-day Iran, the Persians were known for their advanced contributions to science and medicine. Dentistry, oddly enough, was no exception. While today we rely on modern equipment and anesthetics to ensure a relatively painless experience at the dentist, ancient Persians had to rely on the resources available at the time. A combination of rudimentary tools, herbal remedies, and sheer resilience. Imagine dealing with a toothache without the relief of Novocaine. In ancient Persia, the agony of a decaying tooth or a severe infection could lead to desperate situations. The Persian solution? Early drills made of flint or obsidian crafted by skilled hands. These were not unlike modern dental drills, albeit vastly more primitive. These stone drills were manually operated, requiring steady hands and no small amount of courage from both the healer and the patient. The process involved drilling into the decaying part of the tooth to create a shallow well. This procedure relieved pressure, reducing the pain caused by trapped fluids or pus. However, when a tooth was deemed too far gone, extraction was the final recourse. The technique was surprisingly simple yet effective for the time. Using primitive forceps or tongs made from metal or strong wood, the healer would grip the offending tooth with all the might they could muster. With forceful pulls and yanks, the tooth was eventually coaxed from its resting place. Pain management, as we understand it today, was non-existent. Instead, ancient Persians utilized herbal concoctions, a mix of opiates and perhaps wine, to dull the senses of the ailing patient enough to withstand the process. It wasn't perfect, but it was the best they had to offer. Surprisingly, the reverence for dental care in ancient Persia extended beyond mere practicality. The rituals and practices surrounding dentition were linked to spiritual beliefs. Teeth were seen as a representation of personal health and vigor, and thus maintaining them was infused with both medical and mystical importance. In contemplating these early methods of tooth extraction, one cannot help but marvel at the resilience and ingenuity of these ancient practitioners. They worked within the constraints of their time, yet managed to lay the groundwork for what eventually evolved into the sophisticated field of dentistry we know today. As we conclude our glimpse into the past, we gain a deeper appreciation for the feats of medical practice our ancestors achieved with limited resources. Their challenges and triumphs remind us that the quest for health and well-being is as old as humanity itself, a testament to the enduring spirit of innovation driven by necessity.